My dream for this partnership is that we provide care for everybody. This intentional working together makes that possible in a way that hasn't been before. I want this to be care for the entire community.
St. Helena Hospital is launching a pioneering partnership with Olay Health to increase access to healthcare services for all patients in the Upper Napa Valley. With your support, we'll invest to develop a health and wellness center in Calistoga to provide primary care, women's health, prenatal care, dental, nutrition, chronic disease management, and more. Together, we'll improve patient care and well-being for the entire Upper Valley community.
In places in the Upper Valley, even when Olay Health and Adventist Health are in the community, we're only taking care of half of the people in the community. This partnership represents a way to really solve that problem. I don't want the hospital to be a place up on the side of the hill that you go when you need x-rays or stitches in the ER. And we need to be down in the valley caring for our community.
Every day in my small practice of dermatology here in St. Helena, I'm honored and humbled to care for the residents of our community. I think it is safe to say that David and I are fiercely committed to having excellent health care in the Napa Valley.
This is so important in a small community like ours to have all the generous people that we've been surrounded by, and we've played a little part in making this happen.
And both of us feel that having a healthy community makes for a happy community. And we can't think of a better opportunity to raise funds than for this collaboration between Olay Health and the St. Helena Hospital to raise the bar for primary care in our Up Valley community.
I probably see Olay Health patients on a daily basis. It's certainly been increasing since when I started 5 or 6 years ago. One of the things in the valley here is we've got some great primary care physicians, we just don't have enough of them. And I think the partnership between Olay Health and Adventist Health is going to benefit the community, because really we have patients every day who say, gosh, I can't get in to see a new primary care physician. Can you be my primary care physician, or can another specialist be my primary care physician? And we just don't have the bandwidth for that. I heard about Aldo Nunez before I met him. Dr. Bermudez had called me and said she was very concerned about a patient who she'd done labs on.
Aldo came to my clinic in the fall because he was having bruises on his skin. So he called and my staff was able to get him in for an appointment. I was off the following day when I received a call from my medical assistant on a Friday saying that he had a critical lab value, and she read out the lab values to me, and his platelets were at 12,000. And normally platelets are around 150,000 to 400,000.
It was Friday morning, I got a call, and Dr. Bermudez said, you need to go to the hospital. Emergency.
I said, I'm really concerned, I'm not sure what's going on, but it's not normal to have the platelets that low, and you can have like an internal hemorrhage.
I got in my truck and I drove up to the hospital, to the emergency room. There was a doctor here, and when he saw me and he said, he says, you have leukemia. I said, what?
It was dicey for a little while, but
yeah,
you got through it.
I know, together.
It was a life-threatening situation. So I think if he hadn't gone that day, I don't know if he would be alive. I think having the formal ties with the hospital will increase the access, and so, hopefully that benefits the whole community, the health of the whole community.
I call you my angel. And I do want to thank you. Forever, and I've told you that, doctor. You'll always, always be in my heart. Always.
Please join us in supporting the two best healthcare providers in the state of California.
We need each other.
We can't do this alone.
We have to do it together. Raise your palates high, and remember, you can't take it with you.